Welcome, Kelda, and thank you for being here to share your birth story.
No problem. Happy to be here.
You are joining us from Alberta, and you yourself are you say new pelvic health physiotherapist. I see a pelvis behind you in the background.
Yes, yeah, I did some trainings about almost 2 years ago now, and with my own pregnancy and being off with baby, I'm kind of more just getting into it now with seeing more patients. But yeah, it definitely brought kind of a whole different perspective to everything with going through my own pregnancy and birth experience and postpartum.
Heck, yeah, for sure. So how old is your little one now?
He is nearly 10 months. So he was
Okay,
born in December. Yeah.
excellent. So almost you've had quite the year. I mean, you're not even
Yes.
a year postpartum.
Yeah. Yeah.
It looks like you're back at work in the office joining
Yes.
us. Okay. So you had an unplanned cesarean birth, and I remember reading
Yeah.
your submission when you did the prenatal Pilates and push prep course.
Yeah.
And I wanted to talk with you because, there's obviously so much to process, and you did mention that you felt disappointed that you weren't using sort of, we'll call it the pushing techniques that you
Yeah.
learned, but that a lot of what you learned has helped your recovery.
Yeah. Yeah. So I think, especially being a pelvic floor physio and, taking your course, I was so ready to be like the most prepared, pregnant person ever going in and thinking, I think I had a lot of maybe naive but idealistic views on how it would go, and then things kind of just went sideways, and it went a lot differently from how I thought it would be. And yeah, I kind of it did feel like, okay, well, I missed out on being able to use these techniques, or be able to go through the experience of labor and delivery. And it was just very different from what I expected. And I mean, the at the end of the day, my baby and me are safe, and that's what matters, but definitely was different from what I thought. And there's some sadness around that for sure.
And I mean, I'm going to ask you to, if you're comfortable with it, to share your actual story if you want to go there. Um,
Yeah.
but I'm wondering if, you have found that it's gotten easier in terms of the processing. We've had only, I mean, granted, it's still
Yeah.
only been 10 months, but maybe you can
Yeah.
walk us through sort of like where your head's at right now compared to maybe how you were in the more immediate postpartum period.
Yeah. So more immediately, I mean, we also ended up with a NICU stay and a lot of kind of scary circumstances around that. So immediately postpartum, it was difficult to think about. It was difficult to, see pictures of other new moms holding their babies right after birth, because I didn't get to hold my baby for 2 days. And also just having, friends going through it and, experiencing labor. And I think I built it up in my mind, if I really want to do this thing, and I being kind of the type A person I am, that I'm going to be the best at it. And then kind of everything happening very quickly as it was hard to even think about or talk about, and just kind of grieving over not having the labor experience that I was excited for, terrified but excited, and like preparing for so much. It's definitely gotten easier the more I talk with friends about it, talk with my husband about it. And I've been kind of on a wait list for going and talking to someone, for just some therapy, kind of processing some stuff around that, now that I'm kind of feeling more ready to talk about it. And
Mhm.
yeah, but it gets easier over time for sure.
Yeah, I can see the emotion in you, and that, so thank you. I know this might be draining, and if you need to stop at any point, we absolutely will.
Yeah, no
Uh,
problem.
Um, I know because I've had so many conversations with other women who've had unplanned experiences, plus you layer on a NICU stay on top of that, and that's traumatic in and of itself. I mean, that's a lot. I think we need to
Yeah.
pause for a second. Like, that's a lot,
Yeah.
a
Yeah.
lot, a lot. And so, are you okay to go into what actually happened on the day that
Yeah.
you gave birth? Okay.
Yeah, for sure. Yeah. So I live in a really small town. It's called Pincher Creek. And it was difficult to find a doctor to begin with, but I did find one that was good here. And my plan was to give birth locally at my local hospital because they've got nice big rooms, and my doctor was there. And I thought, that'll be great. And we get further along in my pregnancy. I got to 40 weeks, nothing was happening. And then I had planned an induction for 41 weeks. The day before that, and well, actually 2 days before that planned induction at 41 weeks, I was certain my water broke, and I was getting some contractions. So we went in, it was a Sunday night, it was a snowstorm, and the hospital had no surgical coverage. So they said, well, if my contractions then eventually stopped, and they just told me to go home because they said, well, if you go into labor now, you actually have to drive just over an hour to Lethbridge because we can't do a C-section here if that's what happens. So luckily I went home and things kind of settled down. Then the morning, 2 days later of the planned induction, I was having some mild contractions again, and we go in for like 7 a.m. when you're supposed to, show up, and they hook me up to the monitors, and my baby's heart rate was really high, and my blood pressure was really high, and it wasn't calming down. And the more I kind of had a few contractions, he just was not tolerating it well. And I'd had an ultrasound the day before that showed that he was probably going to be over 10 pounds in terms of birth weight. So that's what the ultrasound said. And so the decision was made just based on already his heart rate being all over the place, being really high with mild contractions, and the probable size, that it would be better to have a C-section. And also potentially with my own high blood pressure, some signs of preeclampsia going on. And I had a lot of weird symptoms in my pregnancy as well that were difficult to manage, but all culminating in this. And so my doctor said, well, we could do a C-section here, like the surgeon's here today, but I would feel better with you being somewhere with a NICU. And just this gut feeling that she had, which turned out to be really important. So they put me in an ambulance.
And you're in labor in the ambulance.
Yeah.
Oh God.
My husband following behind in the car. And at the time, I think I was a little bit detached because I was like, oh, that's funny. They're doing lights and sirens on the way to Lethbridge.
Oh, girl.
And at the time, I'm like, oh, this is cool. Like, I'm in an ambulance. And I get there, and it's a surgeon who or the OB doing the C-section was just there for a day, kind of filling in at the Lethbridge Hospital. And they kind of fit me in right away. And, that all went smoothly in terms of surgical procedure. And everyone, it's kind of a nice environment. Everyone's having fun in the surgery room. Everyone's placing bets on how big this baby is actually going to be. And so then they pull him out at me, and they say, I think one nurse said, congrats, you gave birth to a toddler.
How much did he weigh?
9 pounds, 12 ounces. So not as big as projected, but still a big, big baby. And he cried, and they did the delayed cord clamping, and they moved him from like just above my belly over to the little incubator place over there. And then things kind of went downhill from there. He wasn't able to get oxygen. So he was turning blue. His oxygen sats were really bad. And then all of a sudden they're wheeling him out of there to the NICU. And I said to my husband, you go with him, like just stay with him. And then I had to wait while they finished sewing me shut, and in the recovery room, just trying to get sensation back after the epidural for the surgery. And I hear back as I'm waiting, I think it was taking a little longer than ideally for the anesthesia wearing off. And the pediatrician comes in and is trying to explain, okay, there's something wrong with his heart and his lungs, and we're trying to figure out what's going on. We have this whole team trying to figure it out, but just updating me. And I guess my husband had to see just kind of our son just tank crash, and they're trying to, all of a sudden a bunch of staff kind of converging on him and trying to get an oxygen, trying to figure out what's wrong. They were able to rule out that, okay, it wasn't a deformity in his heart, but something with his lungs. So then they got a team from the Children's Hospital down from Calgary on a tiny plane called
Oh,
the NICU. I think it's transport team. So really highly skilled nurses that are trained in delivering a specific type of medication for opening the blood vessels in the lungs. Because what had actually happened was he was born, things were good. They cut the cord and he's trying to breathe on his own, but the blood vessels in the lungs didn't open up for whatever reason. Sometimes it's just bigger babies, a C-section can be a part of it. And so he needed this medication called nitric oxide, which opens the blood vessels of the lungs. And they can only administer in Calgary. So I'm kind of getting all this information secondhand, third hand. I'm stuck where I am, and my parents show up from, they were like 3 hours away. And I'm just trying to figure out, we don't know what's wrong with my baby. So a couple hours later, I get to finally meet him for the first time, and he's kind of purple and he's hooked up to all these tubes and on a lot of medications, but he's stable. And then that night, they put him in a little like an incubator to go on the plane, and they took him on the plane back to Calgary.
then you stayed.
Yeah, and I had to stay in Lethbridge.
Sorry, I just sweared. Fuck.
Yeah,
Sucks.
that was the worst night of my life.
Oh
Yeah,
my God.
being in the maternity ward, hearing other people's babies cry, and I couldn't be with my baby, and we didn't know how bad things were, and I guess just spoiler alert, he's fine now. So, but that was definitely really difficult. And they moved us into a new room that had just been renovated so that I could be in a private room, because I had been absolutely losing my cool in a shared room with someone before that. So, but then my call bell wasn't attached to anything. And I just had a C-section and had to, I needed my pain meds and I had to go to the bathroom. And eventually I got up and got myself to the bathroom
Oh my God.
and pressed like the emergency button in the bathroom to get the nurses to come. So it was just, yeah, painful and
And
sad.
you were like
Awful.
discarded into some room because you were making too much noise, and
I
you were
think they did it. I actually am appreciative of them for moving us. They allowed like more family to be in that room with us than was technically allowed, and just allowed me to have some privacy while I dealt with this. And my husband was with me too. But yeah, I think that room wasn't quite ready to have people in it, and they last minute like got it ready for us so that I could be somewhere more private and so that family could be with me. But yeah, the call bell wasn't working.
oops. Oh my God, I'm like getting emotional listening to your story. We talk about, I don't know, my head immediately went to this place of like, you have your baby, and now like the worst thing is that this is so primal. The smell, the only voice the baby knows is yours. The only smell he knows is yours. And then you're separated. It's like someone ripping your heart out. And
Yeah,
you've also have to navigate. You just got your whole abdominal wall cut open. You've
yeah,
had massive surgery. And now this consolation prize is a baby, but you don't even have your baby. And
yeah.
you're in a room without like pain meds and support. Like this is just one cluster after another. It's ridiculous.
Yeah, it was like, yeah, what could go wrong? And I think, I was so positive, like in the ambulance, like I was just like, oh, like it's going to be fine. I think sometimes my protective mechanism is I don't even like to think about what could go wrong. And so some of it is that I wasn't really prepared to have a C-section, or I wasn't prepared for things to go wrong. And I guess talking about that later on would be, that's what I would try to tell other people, is you need to have these contingency plans, or to at least start to wrap your mind around it. Because it was a big shock. It was not at all. That was not what I'd planned. And I'd already had to come to terms with, okay, I didn't want to do an induction, but he was big. It was 41 weeks. I was so uncomfortable, and I was like, okay, well, I'll concede to having an induction. Like, great. But yeah, I wasn't prepared to have a C-section, because I just didn't even let myself think about that as a possibility. I didn't want that to happen. So yeah, but that night, like you don't realize until you experience it, just that need to hold your baby.
Yeah.
And he'd been taken out of me and moved away and I couldn't even hardly see him. It was hours before I could touch him, and days before I could hold him because he wasn't stable enough to be picked up. And so it was, yeah, just that primal feeling of I need my baby with me, and he's, a 2.5 hour drive away. And so that night was bad. The next morning, the hospital decided they'd let me out after 22 hours after surgery, instead of 48, because they said you go be with your baby. And which I was just like, get me out of here, get me to my baby. And so my parents drive me up to Calgary, and we get there, and I'm spending the rest of that afternoon in the NICU. And luckily we had a close family friend who lives in Calgary near the children's hospital there. So we got to stay there. And my parents came and stayed with me as well, because they were worried about me, and my recovery from a C-section. And I also have a history of struggles with my mental health. So I think they just wanted to make sure I was okay through all of this. And so, yeah, it was that. I think definitely staying on top of your pain meds is important, because I didn't. And that first day postpartum, I just was so focused on seeing my baby in the NICU, that by the time I got to my family friend's house that night, I could hardly walk. I was in so much pain, I nearly passed out. And yeah, I just kind of had pushed it too much. I wasn't even supposed to be out of the hospital, let alone, walking around, or I would, wheelchair to the NICU. But it was a lot. It was a lot to process. But, and then the next 10 days or I guess 9 days after that, we were in the NICU. And he luckily made a really quick, for that type of thing, recovery. He was the biggest baby in the NICU by far.
I'm sure. The linebacker.
All the nurses were like, "Oh, you have the chunky baby in room whatever." And he was a fighter. And yeah, it took just a while to kind of wean him off of the medications that were helping keep valves in his heart open, or that were helping opening his lungs and oxygen and everything like that. And then we took him home, 10 days after he was born.
Oh my God. We need to pause there. So thank you for sharing that. I know I can imagine that it is not easy to
It
bring
gets easier the more that I tell it. And yeah, and the more I tell it, the more I talk to other people that have had, NICU experiences or traumatic birth experiences. And I think that there's value in sharing it, both for the people sharing and for people that are listening.
100%. None of this was your fault. And I know that you know that, but sometimes it needs to be said.
Yeah. Yeah. It's, you always you go through your mind thinking, okay, well, what could I have done differently? Should I have gotten induced at 39 weeks, like that big study you suggested, or, and I was learning like, well, that's not necessary, right?
Yeah.
And there was one pediatrician that said the antidepressants that I was on could have played a role in causing this. Is called PPHN, or now I'm prolonged pulmonary hypertension of the newborn. So blood vessels not opening. But anyways, there is a connection between the antidepressants that I was on and what happened to my baby. And that was also like day 3 postpartum is when I found that news out. And
I'm sure super helpful.
Yeah. And I mean, this was a discussion I had with my doctor and my psychiatrist, and the best decision that we thought we were making was I stay on them, because the risk of postpartum depression was really high. And that can have significant effects on a child and also the mother. And I was just making the best decisions that I could make with the information that I had. But yeah, it's hard not to look back and try to think of what could I have done differently. And that's one of my friends, she had a baby 4 months after me. And she is also really into the research. She's a clinical psychologist, but she always tries to put things in perspective. Like, yeah, what's the cause or effect, right? Like, was he late and a C-section because of other things going on? Was this kind of always going to be what happened when he was born?
Right.
And it's one of those conditions that we just don't, there's so many different factors that can play into it. But I do know that the decision to have the C-section was the best one.
Yeah.
And I'm so grateful to my doctor that said, I'd feel you could get a C-section here, but I'd feel better if you were somewhere with a NICU. So grateful to her and that like little piece of clinical decision making that she just felt like, something doesn't feel quite right. Because yeah, that was really important. There would have been even more of a delay in getting him the medication that he needed had we stayed in my small town.
Yeah.
So yeah.
Oh my gosh, just everything. I've got goosebumps all over my body listening to your story. Just everything from you being in an ambulance by yourself in labor, like why wasn't your husband in the ambulance? Maybe there were too many people and he has to follow, but he needed a car. I don't know. It doesn't matter. It's just
Yeah.
picturing you and what you had to go through and process and so many layers to that. And already you're already coping with, as you mentioned, and thank you for sharing, challenges that you've probably dealt with for a long time regarding mental health. So like, it's like one thing on top of another, on top of another.
Yeah. A lot of layers.
A lot of layers. It's a lot of layers. So, I mean, how has this impacted your postpartum journey in terms of your birth experience? How has it impacted in your almost rounding into your final year of motherhood? How has that impacted all that?
It was difficult. The first 5 months after he was born, we had to be very careful not to expose him to any colds.
Oh my God. And you live in Alberta. Like, come on, that's ridiculous. What month of year was he born? In winter, in the snow?
December. Yeah. And RSV is really bad. And he was getting RSV antibodies because he qualified. But the risk was that if he got sick, the blood vessels in his lungs could snap back to closed. So it was extremely isolating.
You're not
I'd
going
had
out
all
your
these
house?
plans. Yeah, I had all these plans. I was going to join a new mom's group. I was going to do, this, that, or the other and get out. But it was me and the baby. And luckily for the first few months, my husband's a rancher. And so from December to March, he wasn't as busy. It's kind of the slowest part of the year. March starts and then the calves are born and it's, oops. And then it's fiddling with things. And then it's really busy. So luckily in that first 3 months, we got to spend more time together and I had a lot of help. But yeah, and then recovering from a C-section is no joke. I had taken a course on C-section rehab probably 2 years ago now, because I had a friend who went through who was asking me, and then I thought this will be helpful for my job as a pelvic physio. And so I, was kind of aware of all this stuff, like that C-section is not an easy out. It's not. The recovery was really brutal. And I also had a 5-centimeter diastasis.
Well, a 10-pound baby.
Yeah. Yeah. I could fit my whole hand in between my abs. And I have a hernia as well from that. But so yeah, my core just did not exist. And picking up my baby was really tough. You're not supposed to pick up more than 10 pounds after a C-section. And he was nearly 10 pounds. So and I still have pain kind of near my scar, but I think having, really worked on trying to keep my core strong was helpful, at least in that push prep kind of way. I had been working on my core. You then kind of get cut open and you kind of start from scratch, but and a lot of also just like my physiotherapy and pelvic floor training kind of goes into that as well. And then looking kind of at rehab for that and kind of starting at my basics for just engaging
Mhm.
the lower abs and everything like that. But yeah, having, been trying to at least set myself up for success in terms of pushing or preventing diastasis, which I don't think there was any way that I could have, but having some core strength that I had been working on even when I was pregnant was definitely helpful in that. But yeah.
How has this impacted how you approach your patients?
Um, I think that it's given me a lot more of an appreciation for what our bodies go through, even just for people with a relatively smooth pregnancy, labor and delivery, and all of that. But also an awareness of birth trauma, and sensitivity and understanding around that subject, because it doesn't have to be an unplanned C-section, but I have a patient who also just had a traumatic, like a physically traumatic, very quick labor and delivery, and also just any kind of labor delivery. It's a lot, and there's a lot of emotions tied up in it as well. And so when I am assessing or working with women or people that have given birth, it's given me more appreciation and more, yeah, just more awareness of trauma, even if people, they're not disclosing it or they're not outright saying it, that it's there and it happens to a lot of people. And unfortunately, the medical system can play a role in that. And I want to be kind of the opposite force on my patients, is to have a place that feels safe, that is not re-traumatizing or invalidating in that sense.
What would you say? And I can tell already that you're already doing that for people, which is pretty awesome. And really all the shit that we go through, what use is it if we can't then use it to then help others? And it sounds like that's exactly what you're doing.
Yeah,
You went, and
yeah,
I don't want to call birth, you know what I mean? But you went through, I'll call it shit. It's a lot of
yeah,
shit, right? Like it's a lot
yeah.
that you went through. And you're now so much probably more sensitized in a
Mhm.
good way as it relates to the way you interact in a trauma informed way with
Yeah.
your patients. So what does trauma informed mean to you as a practitioner?
Yeah, well, it's always been a big focus with the pelvic health physio training, because just the area of the body is highly kind of responsive to emotional
Mhm.
states. A lot of people have trauma related to their pelvic floor, or even just pain, or it's a very vulnerable experience, right? And a lot of kind of the old medical model is really not trauma informed in terms of how pelvic exams are given, or
Mhm.
colposcopies, or even just with pregnancy and cervical checks and that kind of thing. So being trauma informed, I mean, before my own experience was more just an awareness, and like really it's all about consent and making sure that the person is in control of what is happening to their body, because we often feel like we lose that. And so really it's open communication and empathy, and giving power back to people that maybe feel like they didn't have it, or are not used to advocating for themselves in a medical situation. Now looking back at it from my own perspective, it's also just being aware of how even these discussions can be um, triggering or difficult, and also how that affects our body and our healing postpartum.
A lot.
Yeah, yeah.
A lot. Yeah, a lot. Um, whew, big exhale here. Has this changed the way that you practice?
Um, Yeah, I'd say so. When I'm like, especially dealing with postpartum clients, just even just having more of an open dialogue, or even just being able to relate, as it's, you don't have to have had experienced every condition that you treat, but having been someone who's gone through pregnancy and gone through having a baby, it allows me to just better relate, or at least empathize with people, and having been someone that had a lot of things go wrong does provide me with some lived experience in just how that can feel and how that affects your body and how it affects your healing. And I think it's just made me more, I guess, like open in a sense, of being able to hold that space for people, and not just brushing past it and getting to the physical assessment part of it.
That's huge.
Yeah.
What has been the most important or helpful thing in your own healing?
Um, it's tough. Like, it's still ongoing. I think
Sure.
there's a lot that I still need to work on. And that's, I'm going back to therapy. I'm, continuing to work physically on my C-section scar and my strength. But I think just, yeah, talking with my friends, and also just trying to give myself, permission to feel that grief over my experience not being what I expected it to be or wanted it to be. Um, People are quick to say, well, like, you and your baby are safe, everything happy, it's good. Like, yeah, C-section, whatever. But it's okay to feel disappointed, or grieve the experience that you didn't get to have. And that doesn't make you like a not grateful mother, or um, or that you are just thinking of all the negative things. It's a real experience that happened to you, and it's okay to feel those things. I mean, people do kind of want you to, like, okay, move on.
Yeah.
But I think, and I trying to talk to my husband about it too. I think at first he really didn't understand. I was trying to say, I'm really sad that I had a C-section, and I feel like I missed out on something. And as I want to have another kid eventually, and looking towards planning for, a trial of labor, after C-section, and maybe just having, and having that awareness that, okay, it's could end up in a C-section again, but just being more prepared for it. And I guess then that goes into that question of, okay, well, what would I tell other people? It's that even if you don't, we all think that we're not going to have to need something, I guess, like, oh, that's not going to happen to me. And I was maybe a bit naive in that. I'm like, oh, I won't, I'm not going to have a C-section. So I'll just, skip that part of the, uh, parent baby prep course, whatever. And I guess I had some training in it prior to that, but I kind of just didn't let myself think about it. I just like wanted to think positive things about, how things were going to go, which is important. But I think you also need to be prepared. And luckily, at some point, I had said to my husband, like, okay, if something goes wrong, I need you to stay with the baby. Like, and he was like, well, nothing's going to go wrong. Why are you saying that? And I said, well, I just need you to. Yeah. And but even just trying to prepare yourself for different situations, and it doesn't mean focusing on what every possible thing that could go wrong, but just having an awareness, like, no matter how much I could prepare for labor, sometimes different things happen, and you got to make the best choices that you can. And luckily, we have the ability to keep mothers and babies safe through labors that maybe would not have been, if we didn't have that option. But yeah, I think just allowing yourself to go through, okay, if this happens, what would I do? Or just allow yourself to wrap your mind around it a little bit more. Cause I think I just didn't. I just thought, well, no, I don't want to have a C-section. I don't want to think about it. That's not going to be me. Let alone like the NICU situation. But, and then it's also kind of changed what I look at in terms of what's medically available, and where I might choose to give birth in the future. And it's kind of an unfortunate statement on the state of healthcare currently rurally, that we don't have as much coverage as we'd like to. Um, and so kind of having those plans for, okay, if this happens, I'll do this. And so you're not feeling like you're just completely lost when it happens.
Yeah. The rural piece is a big one. I don't think we talk about enough. And certainly, it's not something I've experienced living in the biggest city in the country. And so
Yeah.
we take it for granted. I think I take it for granted. So I'm glad that you
Yeah.
brought that up for sure.
Yeah. And that's something, that awareness of just how that system is currently working, where I'm at, also helps me with like pregnant patients, or,
Yeah.
Knowing what's available here and knowing the challenges that we face. I think looking towards the future, I want to get more training in even like, you can do some courses kind of moving towards being a doula or being someone that can help guide people through that. And I think that that's something that is really lacking in our area. And like, I put myself on a wait list for a midwife the day I found out I was pregnant. And I never heard back.
Really? Oh my God.
and and my friend did the same thing. She lives in Calgary, and she heard back like 2 weeks later and was able to go through midwife care. But for the first half of my pregnancy, I didn't have a doctor that was following me.
Oh my gosh.
Like specifically, I was just seeing whatever resident could see me. So it's tough, and there's a lot of unknowns. And I think that if through my physiotherapy practice, if I could kind of fill some of the gaps there, I think that that's kind of moving towards the future of what I'd like to be able to do one day.
Oh, oh my goodness. You're amazing. Like seriously,
Oh,
you go
thanks.
through this, I'll call it, I don't know how you feel about the word traumatic, but you went
Yeah,
through,
it was.
you went through a traumatic birth experience, and now you are already using it, and you're still in the middle of processing it. Like this takes
Yeah.
time. It takes
Yeah.
time and grace and therapy and so much. And yet you're already like, okay, I'm now seeing more of these gaps. I'm going to fill these gaps and help other people so they don't necessarily, not that we can prevent everything, but so that you can at
Yeah.
least buffer it a little bit, right?
Yeah.
Yeah.
Yeah. That's, yeah, probably not for a while, but taking courses and running a business and
No
having
big
a
deal.
baby. Yeah.
No big deal. Oh my goodness. You're incredible. You're
Well,
incredible.
thanks.
Thank you, Kelda, for sharing this. And
I'm sorry for taking more time from
sorry,
you.
don't you dare apologize. I'm the
Okay.
one that should we got our times confused because you're on mountain time and I'm on Eastern
Yeah.
time, but we made it work today. We made
Yes.
it work.
Yeah.
Oh my goodness. Um, thank you again. And just give your clinic a shout out.
Okay.
Where
Yeah.
are you
It's it's called Peak to Prairie Physiotherapy. And we're in Pincher Creek, Alberta. And we kind of serve the surrounding area. When I left working in public health because I was getting really burnt out, and I also knew there were no private clinics for quite a drive distance from here. So I decided to open up my own clinic, and so now it's myself and another physiotherapist, and I'm just back 1 day a week now. But yeah, it's been good. It's nice to be able to provide something that is needed in the community, and it's definitely allowed me more balance with my life, I guess, than before. But yeah, if anyone's in this area,
Pincher Creek, Peak to Prairie
physiotherapy.
Physiotherapy,
Yeah,
Peak to Prairie Physiotherapy.
yeah,
Amazing. Well, thank you. And I look forward to staying in touch and hearing kind of all the changes that end up happening down the road. All positive,
yeah.
I'm sure, because of you. And best of luck with your continued healing journey. To
Thank
anyone
you.
listening to this as well, all those comments of, well, at least you have those platitudes. That's a way of silencing, right? Because,
Mhm.
people, so screw that. Tell your story. It deserves to be told. And,
Yeah,
you know, having grace for what you've gone through and recognizing that it's okay. The two things can exist. You can feel tremendous, deep love and gratitude for being a mother, but also be dealing with complicated emotions around a birth that didn't go the way you expected. They're two separate
yeah,
things.
yeah. They can exist at the same time, and it's a process, right? Like 9, 10 months out, I think there's still a lot of work that I need to do. But even being able to tell this story and not cry or completely dissociate, I think is
Crying is fine too. Crying is good. Let it all out.
yeah.
You were like so strong, like so
Yeah.
strong. It's just, I don't know how many people told you that when you needed to hear it, but I'm going to tell you that again. Just everything you've come through and overcome, and now using all of that and fueling it to help others is really incredible.
Yeah, well, I hope I can use it more in the future. I'm just getting kind of back to work now, but I've got a lot of big ideas and a lot of passion about pregnancy and labor and delivery and rehab. And thanks so much for your program. And it did help calm me down when I thought, okay, I'm going to have an induction. How am I going to get through it um, in terms of pain management? But yeah, and it's nice to just have those resources, especially in a small town where there are no classes available like that. So yeah, thanks so much.